Hello, Constance here, presenting for Parenting Genie tonight in Melbourne again. I hope you're all well, and I hope I have maybe a little bit of an audience, and otherwise you might watch my YouTube live at another stage. So tonight, I would like to discuss with you a little bit about herbal medicine and lactation. So you may have heard of women or yourself are a lactation or lactating mother who's wondering which herbs you can take to increase your milk supply. Very well known is fenugreek and also herbs like blessed thistle, alfalfa, and there's lots more. Now, the issue with herbal medicine is that there is not a lot of evidence and not a lot of research into the safety. So what we need to discuss is that everything you take will go through the breast milk and be digested by the baby. And herbal medicine has the potential for side effects as much as conventional, if you like, Western medicine or Eastern medicine. So most substances pass into the breast milk via the passive diffusion, we call it. And very often they are only small amounts. But if your baby is born prematurely, your baby would have quite an immature liver function and also quite an immature kidney function, which means that the substances your baby would have to digest could give your baby some issues. And that's why it's always very important to discuss that also with a pediatrician if your baby is one of those babies who is maybe in special care. An older baby usually is not somebody who we need to worry too much about because that baby has a more mature liver function and kidney function. If you're not sure whether something is safe, and this is not just plant medicine, this could be minerals as well as vitamins. High dosage of vitamins over the counter could have an ill effect on you or your baby. I referred a few weeks ago to one of the databases online that you as a parent could also access, and that's called LactMed. And LactMed is able to give you answers on certain herbal or plant medicines as well. Quite often you will find that it says not enough evidence or not well researched, but considered safe or considered not safe. If in doubt, consult your pharmacist or your lactation consultant, though I have to say not every lactation consultant is having sufficient knowledge on plant medicine. And I should say that even myself, I would have to look up certain things, or I would have to sometimes talk to a pharmacist if I have a client who is asking me for advice. The other thing when it comes to plant medicine is where to buy it. Are you going to buy it online? Is it a reputable source? Because supplements are not strictly regulated for purity, heavy metal, or pesticide contamination, and that could be a real risk, again, for you and your baby, and especially your baby, because it does pass the breast milk. When using herbs, you may start with the single herb approach, which means start with one herb at a time. If your baby develops a rash or maybe colic, you'll know that it would be caused by that herb. If you buy something that has many, many herbs included in one tablet, then you wouldn't know what it necessarily is. Also, watch your baby for changes in sleep patterns, either excessive sleepiness or possibly jitteriness, digestive issues, mainly diarrhea or sudden constipation, and skin changes such as rashes. I would like to mention a few herbs that are reasonably safe. And when I say that, we have a lot of anecdotal evidence of herbs that have been used for many, many centuries already by our grandmothers and ancestors. Indigenous people have a wealth of knowledge on herbs that they would have used. And now we come and say, well, where's the evidence? But sometimes there won't be any evidence because people have used these herbs for a long time and they have knowledge that may not always be research-based, but it possibly is something that works and may even be more superior than what we think. That's just one of my personal opinions, mind you. So herbal supplements that you could use, for instance, is ginger. Ginger is really good for your immune system, for digestion, and you could use it also for postpartum or nausea, if there is something like that. And it can be used in food, but it could also be used as tea, and it could be used in form of tablets. Another safe herb that is used certainly in my home country or mother country of Germany is chamomile. Chamomile is used a lot in breastfeeding mothers. And even when the babies are older, they often give chamomile tea to settle the baby. So chamomile can induce relaxation and sleep, and it's generally safe. It could have a mild sedative effect on you or your baby. Another herb that is quite popular is echinacea. Echinacea, again, is something that can help your immune system. And certainly after childbirth, sometimes your immune system is a little bit what we call down because you've just gone through the big event of giving birth to your baby. So short-term use is considered low risk for healthy infants. There have been reported allergies, but that's very uncommon. When I come to vitamins, one of the vitamins that you can safely take is vitamin D. It's good for immune health and bone health, and it's even highly recommended in breastfeeding mothers. In fact, over 6,000 international units a day is recommended for mums, and it can provide enough vitamin D for your baby via your milk. Now, going back to low milk supply, one of the worries many mothers have. Fenugreek, as I have already mentioned, is a big word in that field of increasing milk supply. And even though there is not that much evidence, it's again something that has been taken for many, probably centuries to help mothers with their supply. Now, there is a drawback. Fenugreek can cause allergies, and it can also cause or exacerbate asthma in people who suffer asthma. It can also lower blood sugars, and that sometimes can cause digestive issues. You know that you're taking enough fenugreek when your sweat smells like maple syrup. Another herb that is often taken alongside fenugreek is blessed thistle. And again, there is not that much research that I could find on blessed thistle. Alfalfa, as mentioned beforehand, is also something that can help with milk supply, but it can also cause diarrhea in some nursing mothers and therefore should not be started very rapidly. Now, there's mothers who suffer oversupply and they like to take something herbal. And apart from managing their feeding pattern by not stimulating as much, maybe doing a different feeding pattern, what they use very often is sage. Sage is a herb that has also been described as the most common weaning herb. Never use it as an essential oil. It is absolutely not applicable for that, but you could use it as tea and you could eat sage lollies. Again, that's something that is very common in my culture. Sage is used for sore throats because it's antimicrobial and antibacterial. So that's why where I come from in Germany, we have sage lozenges. And that could be something, but I don't know. In Australia, we don't really have sage lozenges that I could have seen. Another herb very common used to reduce milk supply is parsley. Now, please do not worry that if your milk supply is low, that you cannot use parsley in your cooking. When we talk about parsley, we talk about much larger amounts, such as making teas. And so it's used to lower milk supply. Never again use it as an essential oil because the essential oil would actually be toxic. Something else that I've been asked in the past by mothers is, could they use turmeric? Because again, turmeric is a very, very good herb to use for ailments and again, to help the immune system. And yes, it is considered safe in breastfeeding mothers and also for the baby, obviously. However, if you are on blood thinners, you have to use it with caution or not at all because it can increase some bleeding issues. I'm just looking at my notes, what else I would like to share with you. Oh, yeah. Another herb or plant that is common for some breastfeeding mothers to use in a topical version is aloe vera. Aloe vera is used to heal cracked nipples, and the gel can be applied to the nipples, but it should be removed before feeding a baby because it has a very bitter taste. And so we don't know what that would happen. We could imagine that the baby would not like to go to the breast if there's a bitter taste from aloe vera. And yes, we don't exactly know how it would affect the baby's digestive system. And it's also to be avoided if there is a latex allergy. And that is quite common as well, latex allergies. So if that's the case, stop using it. I have one other thing that I want to mention, and that's garlic, because a lot of mothers they're concerned that garlic would give their baby indigestion if they eat too much garlic. So garlic appears to be safe in amounts usually used in food preparation. It may change the smell of the breast milk. And we have often suggested this to mothers whose babies are on a nursing strike, if you like, and don't want to feed anymore. Because quite often it has been observed, but again, that's anecdotal, that babies do like the garlic flavored breast milk. And so there's no information on the safety of garlic supplements in breastfeeding, but certainly in cooking and in salad dressings, and so it'll be perfectly fine. Let me see if I've got any other herbs that I wanted to mention to you. Yeah. So there's another one that is very commonly being used, and that's St. John's wort. And St. John's wort is often used for mothers for the natural treatment of postnatal depression. And there's very little information available about the safety and the efficacy in breastfeeding women. So it is recommended that an alternative medicine is considered. So, but you could talk to your pharmacist or your doctor about that as well. Let me see what else I have to talk to you about. Yeah, so the main summary is that there's certainly not enough evidence, and that it is certainly a good idea to talk to your pharmacist about using certain herbal medication. And that is about it for today. Oh, okay. Let me just mention one other thing. So vitamin C in normal dosages is okay for breastfeeding as well. And so is usually normal dosages of magnesium and of B vitamins. But again, make sure that you've got a good supplier, that you know that these medication or these vitamins are produced in an environment where there's hopefully not too much in terms of pesticides or contamination. And of course, being in Australia, I should have mentioned that as well. We've got here in Australia a lot of Chinese traditional medicine doctors, and they use Chinese medicine, and that would be another topic that I can't really answer because I don't know too much about Chinese traditional medicine. And again, we would need to know that those herbs are safe and that they're not contaminated with pesticides and toxins from wherever they have grown. So very important to discuss that. It's interesting. One other little reference I'm going to give you. So this has been a survey that's probably about 10 years old now. And this survey has showed that an estimated 16% of US mothers take herbal medicine, 20 to 45% of Chinese women, 59.9% of Australian women, and 97% of Italian women use at least one herbal product during the breastfeeding period. I thought that was pretty interesting. Okay, that is it for today. If you want to sign up to parentinggenie.com.au for a 2-week free subscription to find out what we're all about, or you would like to have a consultation with one of our midwives, lactation consultants, or maternal and child health nurses, then please do so. And other than that, I shall see you in a week's time. Bye for now.